Welcome back to Mental Health Matters. We got another fantastic show for you guys today. Today we're talking about healthcare technology and what it means to physicians, to doctors of all types, and thereby to all of us who are being treated by people. So it's kind of for everybody. And we got the great Ben is here again today, and the wonderful Nicole.
Hi.
And you are listening to Mental Health Matters with Dr. Scott Terry. You are listening on KRUU 100.1 on your FM dial. And these shows are archived at KRUU FM, and they're also archived at the Ardent Counseling Center, so that's ardentcenter.com, and you can go to the media tab and things are listed there, and that takes you to the YouTube channel if you want to watch them on YouTube or podcast or whatever way you want to watch them. But do stay in touch, and you could see my email there. Contact me, scott@ardentcenter.com, or whatever you want. Anyways, love to hear from you. Back to the show. So, Nicole.
Hi.
So tell us about yourself.
Well, my name is Nicole, and I work for the Fairfield Ledger, and I'm so happy to be here. It's just a joy to be able to share with you all today on Mental Health Matters, and just great to be here.
Great. And Ben?
I'm Ben Picard, and I'm a healthcare entrepreneur, and we're eliminating wait times at doctors' offices with pretty cool virtual waiting room technology.
Okay. And so you're into technology, right? So your big thing is talking about technology, right?
Yes, sir.
So what does that mean in terms of, like, to somebody who doesn't understand? Because I think technology, waiting times for doctors or something, like, what does all that mean?
Yeah. So,
like, what is the broad topic of technology? I mean, because you think, okay, I'm a brain surgeon.
Mm-hmm.
I'm using technology to, like, look in laser focus where in the brain something's happening and how it's happening. I'm using MRIs and all that kind of stuff. But most doctors, including most mental health professionals, most everybody has to deal with technology. So in your world, there's a number of things that really impacts. As a clinician on the other side for psychotherapy or psychology or counseling, social work, psychiatry, for a number of the fields that I manage, part of the issue is we're always using technology. Every one of the therapists I train, and I've got about 70 clinicians who work under me in about 19 locations right now. And what's really amazing is how much we are reliant every day on technology. Who is the person that we're working with? And so sometimes it's the client in the room, but it's also kind of the insurance company and the electronic systems that we're working with to document and to also have HIPAA privacy regulations and how we're working with people. Technology is still part of that. I have clients literally around the world. I have clients in Australia and India and Israel and many places out the U.S., all video conference, all secure video conference. And it's, again, technology, but how are we utilizing that so it's productive for everybody?
Well, when I think about technology in healthcare, really I see it in two different camps. There's the digital health infrastructure and the automation that comes from that. And then, there's even the robotics in the surgical setting that, can literally displace surgeons. And perhaps one of the more profound statements on technology in healthcare I just heard from Vinod Khosla. He's a Silicon Valley investor, and heard him speak at the J.P. Morgan Healthcare Conference in January out in San Francisco.
I mean, that's profound, even just saying that, because what that says is, where's the money going? Because you can't separate out finances from the healthcare world.
Sure.
And so when people talk about healthcare reform, it is intimately tied together in this country, not so much in other countries. And that's part of what drives up the cost. But it also creates innovation. So it's really a mixed bag.
Sure. Yeah, and Silicon Valley is taking notice. And Vinod, in particular, claims that technology will replace 80% of doctors because machines driven by big data and computational power will not only be cheaper but more accurate than the average doctor. And I believe that's absolutely true and can explain a bit more. My friend and mentor, Ann Wojcicki, basically started a biotech and genomics company called 23andme.com. And it's named
Great
for
name.
the 23 pairs of chromosomes that we all have. And she was backed by Google in 2007, maybe partly because she married Sergey Brin, Google's founder. But anyway, $250 million in venture capital subsequent to that. And what 23andMe did was they began by selling cheek swab kits and then tracing those participants' lineages back to ancient Mesopotamia. And no big surprise, we're all cavemen and cave women, fundamentally. But anyway, next it was shown that even markers in our saliva could show a proclivity towards certain diseases, like cancer and such. And all they needed to do was collect the data and then leverage the computing power of our day. So the next time that any of you go into the doctor for bronchitis or anything, just think about the swab that they take to test for strep throat, or the blood test to screen for a disease, and even pregnancy tests and pee sticks. I mean, it's all really just kind of technology. And with these types of technologies that are out there, then, I mean, it's easy to believe Vinod Khosla in that ultimately very few doctors will be needed with these new methods of diagnoses.
Wow. And today you were mentioning this, and this was just prior to the show. You were talking about how medicine has changed, and I can even say that for myself. I'm just using personally. When you go to the doctor's office, a lot of times they don't even touch you. They'll ask you a series of questions. How are you feeling, and what's going on with this? Again, they'll take some tests, they'll run some tests, take some blood, but it's kind of like they come back and it's like, oh, you've got this, you've got XYZ. So I can kind of see that too, but then at the same time, I mean, when you've got a human being there, it's going to help rule out some of the errors that I think technology might have. I'm sure there's going to be bugs initially. I don't know. I'm kind of a proponent of seeing a human being.
Yeah, absolutely.
being my doctor, even though they're barely touching you. I still.
And in this day and age, when we go into today's walk-in clinics and primary care clinics, more often than not, you're seeing a nurse practitioner who basically collects your data and then types it into a computer for analysis. So, I mean, in economic terms, really what's happening with doctors and their jobs is called disintermediation. So technology and lower level practitioners are taking their jobs. And we're even seeing it in surgery with robots making less mistakes, better stitch work, and such than surgeons. So this is really happening. The only real setback so far is that machines can get very confused, especially when asked to make ethical decisions.
And there you go.
What was that term again, by the way?
Disintermediation.
And say what that is again?
Yeah, I mean, it's basically anytime there's a broker in the middle, and their jobs or their part of the value chain gets replaced by those on either side of them. So,
but it does make sense that the system's looking for less costly, effective ways. There's a lack of psychiatrists in my field, right? An even greater sense of lack of child psychiatrists or other specialties. So a nurse practitioner that can prescribe meds makes perfect sense. And in our company, we've got a number of people. We have got nurse practitioners who are very skilled at prescribing meds, and sometimes more than the physicians. But I think I'd like to say that even in my field, that we will never be replaced, and I think that's not true.
So then I want to narrow this down. Are you meaning general practitioners, but you're not meaning like obviously not a brain surgeon or some, a cardiologist. You're meaning initially general practitioners might be replaced by nurse practitioners or physician assistant.
It's all really about the degrees of separation that you have from, when it's actually needed to, have your hands on a patient to examine and such. So, I think the first to be replaced will be the general practitioners and such, where it makes a lot more sense to put it into a computer, and because if programmed correctly, it's not going to be making nearly the amount of mistakes.
Yeah,
wow.
But you could sit there and fight this, or you could sit there and say there is advantages and disadvantages.
Right.
And for instance,
you think about all that schooling though, and those student loans, for someone who's going to medical school, they get out of school with about $100,000 in student loans.
Oh no, it's way more than that. Yeah.
Right. So again, this is something I think would be a little disheartening for physicians hearing this.
It would, but it's also, I think, comes back to pragmatics. I think sometimes it could be useful and sometimes it's not. And again, for instance, the algorithms for therapy. There are certain simplistic things that computers could already do, maybe more efficiently than some therapists. That doesn't mean that you might not need a therapist. It might mean that, hey, I've got a computer or an app, right, that could actually be more supportive because maybe that therapist isn't around at 3 a.m. and I'm freaking out. Or I've got bad PTSD and I need to learn how to regulate with myself.
Mm-hmm. Right.
It's not all bad and it's not all good. It's like everything. We can't think of anything.
It's just changing.
Yeah, it's just sort of like, okay, so how can we make best use of it? Mm-hmm. And maybe for brain surgery, eventually a robot could do that better because it could be more accurate. So much of it right now is so technologically driven that, that doesn't mean that there couldn't be an interface. Like on Star Trek, where, it's like, hey, it's, right?
Yeah.
I hear you.
Yeah. And another thing that's really happening out there these days that's going to impact healthcare greatly is these personal health care tracking devices, in particular mobile. So, kind of the classic one out there is Fitbit. It's a wireless device that tracks steps walked, heart rate, quality of sleep, etc. And these types of wearables are going to continue to proliferate to increase the capture of our individualized health data that nurse practitioners or even lower level operators can plug into machines for analyses and then get the prescribed remedies for those.
Yeah. Or there's wearables all the time. Yes, for something, with a heart patient, but also, like, again, for my example, the Department of Defense, the DoD, has the best free apps, for instance, on PTSD right now. Mm-hmm. And so whatever you think about the Department of Defense, there's some wonderful stuff that they do for both the very low-level kind of support as well as incredibly high level. That doesn't mean that they're really good in the middle, because a lot of times they're not. Right. So it's everything's right now a mixed package, but I think part of this whole debate about the healthcare reform is also about how technology can be utilized in a productive way. And so if you're listening to this and you go, hey, one of these apps, some of them are absolutely crap, but a lot of them are really good and really helpful to sort of get basic stuff. Oh, CBT for myself, or breathing exercises, or, different levels of reminding myself to focus in a different way.
Sure. Yeah, and if you think about it, I like the way you phrase it, Scott, about how being pragmatic about some things, the apps are better for, some things the doctors are better for. And, going back to economics, David Ricardo's theory of comparative advantage says, give those tasks to that, person or robot that can do it the best. So the other thing that we really need to talk about, if we're talking about the U.S. doctor is this whole notion of medical tourism. And so say, Scott, that you need a corneal transplant. And
that sounds nasty.
Yeah, it does. Just one, though.
Oh, okay. All right.
But, you know,
Not as
per
painful.
eye, in the U.S., it costs $17,500.
Wow.
Now, in India,
Yeah.
costs $3,000. So
Per
then
eye.
per eye. But then you can pocket the remaining $14,500 left over. You know, take 6 months off and a trip or two around the world. So patients are going to these other countries in droves, which takes their surgical volume up, which drives their prices down even further. And via this type of specialization, their surgical success rates are just circling higher and higher. So that's really happening, and you know, it's something that we need to take note of in the U.S., especially if we're heading into the medical field.
By the way, you're listening to Mental Health Matters with Dr. Scott Terry, and today I'm with Nicole and Ben, and we are talking about medical technology for physicians, but for other groups, and really looking at how it impacts physicians, but also how it impacts us as consumers, and thinking about, you know, this isn't something, you know, to fight. This is something to sort of get on board with and figure out how we can utilize it in a way that works for us. And I love how you're talking about medical tourism. So this is true around the world. My brother-in-law had problems with his mouth. He's an Australian, and they have great services, like really great medical health system, much better than ours for the general population. It's kind of like Canada, much better than ours. But for specific areas like dental, they're terrible. So he did a medical tourism to the Philippines, which he had the extra benefit of finding his wife there and getting married.
There you go.
And it was
neat.
it's like, hey, double bonus.
It's a big bonus.
Hey, wait, I get my teeth worked on and I get a wife. Hey, this is great. You know? So it's kind of like, what is it that works for you?
Right.
And for some people, they'll say, oh no, India, you know, I'm afraid of that it's not going to be as healthy or as clean or, you know, as competent. And you know, it's like, yes, buyer beware, be careful, check it out. But this is how things are moving. And so, again, not fighting it, but going, what works best for me? And it's not always, well, do it where I'm at, or we're the best, or, you know, whatever. And I think we're the best also becomes another trap and just another realm of this before you get back into it, Ben, is that one of the areas we've talked before about is that in this country, everybody's gotten lost in the need for highly specialization. The physician always wants to be the surgeon, not the internist, because as a surgeon or as a specialist in whatever field, I make more money. And so more and more internists, generalists, are being taken out of the picture. What's actually needed is more internists, not more specialty surgeons. And sometimes as we talk about robotics and other things, what you might need is a general physician, say, go through this door, no, not that one, and gives you more the general outlay. I mean, there's a wonderful physician I go to here, Dr. Kiranova, who I love.
She is great.
She is. And sorry to give her a plug, but, you know.
I'm giving it to.
But, you know, it's like sometimes there's really good people here, and it's kind of going, sometimes you need somebody who's just a smart generalist, and maybe she's been terrible for you. Maybe she's been great for you. But the point is that you're the one who needs to know what you need, not the doctor. The doctor is the guidance. You're the one who needs to know what you need in all these capacities, and then let somebody guide you to go, oh, I don't need to be an accountant. I have a great accountant in town. You know, Fred, he's a great accountant. If he works for me, maybe he's been terrible for you. I don't know. So don't use him if he's terrible for you, or use him if he's great for you, or you need, you know, find what works for you as we come back to the answer for all these kind of things. And there's a roundabout way of saying that. So back to medical tourism.
Yeah. Well, let's actually perhaps take a look at, since the name of the show is Mental Health Matters, let's maybe bring it home with mental health and what some of these technologies that can cross borders really means like for psychologists and such.
So what are you seeing?
So, you have clients in Australia.
Mm-hmm.
You have clients all over the world that you probably sign on to Skype or something of the sort.
Except not Skype. Skype isn't HIPAA compliant. But,
Sure.
and so every one of these things these little nuances become a big, big deal.
Mm-hmm.
And so we become beholden to the very technologies. It's like, sign up for Skype. Yeah, except no.
Sure.
Yeah.
And so every one of those things costs a little bit more,
Right.
makes a little bit more wrinkle of having to know things. And so how do you make it work?
Yeah, and ultimately, I mean, Skype and these types of technologies, they've been around for the past 30 years.
Yeah.
And they haven't been adopted in part because patients didn't have these types of technologies. They weren't enabled. Now they all are with their smartphones, but really the reimbursement and the insurance companies haven't been willing to reimburse these types of,
Yes.
for 30 years. That's been the major holdback.
And now we're seeing a lot of that mix. So I have an old new client who's coming back to me after not seeing him for many years. Wonderful person. And he's in Oregon. And he has a particular kind of insurance which is terrible on many fronts, but happen to be fantastic with telehealth. And
Wow.
again, now there's also legality issues of can I actually see him given the state he's in? Because some of the laws start saying if I'm legal where I'm at,
Would you have to be licensed in,
In that
Oregon?
state.
Yeah.
Sure.
Okay.
now that's certainly not true with a client in India or in Australia or Israel or other places. Certainly in the States, some states are different and some states are yes and some states are no. And so every one of these things is a nuance and can make your head spin.
Sure.
But you as the consumer has to go, what's best for me?
Yeah, and ultimately, a lot of these legalities and such are going to fall. They're going to take a
Absolutely.
long time to fall, but there's no stopping it. And I want to talk about Vinod Khosla again, the Silicon Valley entrepreneur.
Yeah,
No,
brilliant.
not entrepreneur, investor who claims that 80% of doctors are going away. Now, he just invested in this mental health company and mobile app called Ginger.io. And, him and the others in Silicon Valley have backed it to the tune of $30 million. And the premise is this. So the way we interact with our smartphones can provide some incredible data in diagnosing mental health disorders.
So true.
For instance, if we log into our phone, we as the general population log into our phones 80 times a day. That's kind of scary, right?
Oh, wow.
But then, that dude who does so 160 times a day, might have ADHD, and it's another data point to consider anyways. And then, more than 50 selfies a day, might be indicating narcissism. And checking one's phone multiple times each night could indicate a sleep disorder. So, all of these, that's kind of data collected on an individualized basis that can be taken to a mental health professional or even just plugged straight into a computer and, start to pick up on some of these patterns and such that, you might not even need the counselor, to coach you through it.
I'm interested to know what you think about that, Scott.
Well, some of I think it's fascinating and I think it's true. But I think also what's really interesting is the utilization of some of these apps. So like there's apps like for mood journals that could say track my mood throughout the day or track my sleep, which is indicative of just about every single condition from depression, anxiety to PTSD. Sleep issues are the central biggest core. So if by checking my mood throughout my day, that awareness, yes, it could become obsessive, but it could also be like, oh, I get that I'm starting to get lost in somebody else right? We're talking before the show about, in relationships, every relationship, we start focusing on the other person as being our issue, and we get lost in outside ourselves, right? Or we get lost in our own head as, we're right and we can't see outside our own skin, right? And that's how come you need a third party. Well, sometimes the app can provide that third party perspective, like, oh, yeah, I'm getting lost. Oh, I need to take a breather. Oh, I have a timer that tells me every 23 minutes to take a break and come back to myself. Students that are studying get that point of diminishing return that, hey, right now I'm not focused. So come back to my breathing and taking care of myself. What do you think, Ben?
Yeah. I mean, I think that there's kind of a purpose for every tool out there. And if we really focus in on our individualized health and well-being, there's kind of a suite of tools out there for us and resources available to us that, in some cases includes the doctor. In other cases, it's online research. In other cases, it's an app that really can help coach us, given our conditions and our goals to end up with the best personalized healthcare outcomes for us.
So let me use the words you said in a different context, sweet. And it's a sweet spot, so to speak. With all this kind of stuff that, again and again, one of our things is to get out of black and white thinking, all or nothing thinking, right or wrong, good or bad. And to think, okay, how am I utilizing technology instead of being afraid of it and taking control to the extent that I could use these tools? Use a therapist if that provides some benefit. Use a physician in the way that works for me. Use medical technology. Use, medical tourism if that's useful for you. Use what works for you, but the biggest point is creating that awareness so that you know what your sweet spot is instead of getting lost in your partner or lost in yourself or lost in the stuff, the overwhelm, because it's so easy to get lost and overwhelmed today with this technology. Come back to what works for you, but keep growing. Because it's just going to keep growing, and so it's time for all of us to keep growing. That's a good thing. None of us should be stagnating.
Absolutely.
So, Nicole, what do you want to say to start finishing up here?
Well, I would just like to say, wow, just hearing this is making me think there's so many things. I remember just being a kid. I'm going to be very quick.
Yeah.
I never would have thought that there'd be an internet. And then we obviously, we can't go a day without it. So, I mean, as things change, things will continue to change. And if, what is his name? I'm sorry.
Vinod Khosla?
Vinod Khosla.
Yeah.
Vinod Khosla, he's seeing the writing on the wall that things are going to change even more. I'm looking forward to some of those changes because those do mean there would be options out there for people. And so I totally agree with you, Scott. We have to look at these as options. And if they work for us, great. And if something doesn't work, move on to the next thing.
Right. But put yourself back in the driver's seat again.
Absolutely.
And stop feeling that you're getting lost in that overwhelm or procrastinating and avoiding. Come back to how do I take back control over my life again so that I can make a difference. So, Ben, what do you want to say to finish up today?
Well, I think that change is inevitable, and whether you're the doctor or the patient, really you have to embrace it if you're going to be successful in the future. So to those who are pursuing medical degrees, I say that's awesome, but maybe get an MBA too. But seriously, the best careers in healthcare going forward really, I believe, are going to be in the realm of innovating on healthcare delivery models and such, and embracing all the tools and technologies of our day.
Thank you, Nicole. Thank you, Ben, once again for coming. And please come back. You guys are awesome. And have a great day, everyone. Bye.
Bye.
Take care.
Bye.
Take care.
Bye.
Take care.
Bye.
Take care.